Today, we're going to be discussing how to navigate some of the challenging aspects of Parkinson's disease with lifestyle choices and what types of things you should be addressing at different stages of the disease. With us today is nurse practitioner Priya Chaudhary. She is with the Washington University Barnes Jewish Hospital in the Neuroclinical Research Unit at St. Louis, Missouri. Not only is she a clinician working professionally with people with Parkinson's, but Priya also has a mother with advanced Parkinson's. So she is sharing not only from the professional perspective, but also the personal perspective as an adult child. So I know she's going to be bringing a lot of great information, but a lot of passion to what she has to say today. So I'm going to give this over to Priya and let her get this conversation started.
Hello, everybody. Good afternoon. It is so wonderful to see so many people here today joining us. It is really a pleasure to talk to you. Yes, so as Anissa was saying, when I was asked to talk about a topic for Parkinson's disease, and it was, I've been through this on a personal journey myself, that it was hard to just choose one topic. So we have had my own shares of ups and downs. So I just wanted to just in general talk about the things as a patient or as a caregiver that we can do to help. And I mean, it takes a village to take care of somebody with Parkinson's, and it truly does. So I completely understand that. So I just wanted to talk to you. So just to give you a little background about my mother. So when she was diagnosed probably 2013, 2014, so not that long ago, very healthy, no problems before that. And then she started having a lot of the balance problems, little falls, and that's when we got the diagnosis. And just like with everybody, we started on carbidopa-levodopa, the gold standard, of course, even today, right? And she did well for a few years, but slowly we could see the progression happening. Followed up with her movement disorder specialist, increased medications, and we were able to manage. But say about 2017, 2018, so again, just few years into the disease process, she started having some hallucinations, delusions, and all that. But initially it was very innocent, nothing too worrisome. Again, it started progressing. So all her symptoms really progressed. She has had a very fast progression through this journey. So around 2020, it was really bad around the pandemic time. She started having a lot of hospitalizations for UTIs and low sodium, things like that. And those 3 hospitalizations really took her the capacity to be able to walk. She had to be always with a walker. We did still manage okay, but it was definitely the progression was pretty obvious. And then last year, so in the last couple of years, she has really declined to where now she's very end stage. She has had COVID and multiple hospitalizations with sepsis and everything, pneumonia, aspiration. So she has been through a lot of that. So like I said, we have been to hell and back with this. So I just want to talk about how we started and where we are right now. She still keeps fighting. So yeah, so I'm just going to start sharing my screen just to talk about little things that we have put here together. All right, let's see. One second. Give me just a moment while I get this.
Priya, do you see over to the far left, from beginning? If you click that, you're hovering right over it.
From beginning, there we go. Thank you for that. We're searching for that. All right, so today's objectives, we'll just understand in general with the disease process, the motor, non-motor symptoms, some of the therapies, nutrition, and support systems and resources that are out there. So again, when we talk about Parkinson's, we have so much of the motor and non-motor. And I know everybody's disease process is so different and so challenging. And sometimes somebody who does not know anything about Parkinson's, they think it is just the tremors. And I know this image does not encompass everything that's out there, but this is just to talk about there are so many layers that one is experiencing, and they truly say, you know, one person with Parkinson's, you just know the one person because everybody's disease state is different. So let's move on here. So managing the motor symptoms. So the motor symptoms are with your tremors, the slowness with the bradykinesia, the rigidity, you know, the balance, and all of those are the motor symptoms that we are talking about. So some of the tips to talk about. So stick with your medication schedule. I know a lot of people have fluctuations where if you sometimes miss a dose, you really fall down that cliff, and then it is kind of hard to come back up with the next dose. So as much as possible, try to stick with using an alarm, a diary, or anything to keep track of the medications. And I know some of you here must have had the disease for a long time. Some of you might be newer. So some of this might be redundant, but I just want to make sure for especially somebody starting off and struggling. So to emphasize some of these things. And there is so much with the meal times for some people that there is a protein binding factor that if you take your medications with the carbidopa, with any protein source, that it may not have the best absorption. So you may have to take it an hour before or after your meal time so that you have the best absorption, since most of this is going through your gut. So it kind of otherwise contracts with each other. So trying to keep your medication separate. Now for people, if you're having dyskinesias as a big problem with the side effects, you may want to take it with some food so that your dyskinesias are not that intense. So that is very important. And also sleep cycle, keeping track of that. If you have not had a good night's sleep, that again impacts a lot on how you feel the next day. Stress, as we know, stress can worsen tremors and all the Parkinson's symptoms. So taking that time every day to practice some mindfulness, which is important. I mean, it's important for everybody to do that, but even more so with this disease process. This also impacts, you know, the mindfulness as far as having the risk for falls, how you are walking or how you're doing anything. It is so important to be mindful. So practicing that and making sure, you know, you take some time for yourself. And this could be even for a caregiver, you know, that's so hard from a caregiver perspective to have some time to be able to relieve, you know, even if it is just a 15-minute break to just take some time, that is so important. I just want to emphasize any stress to the body, whether it is through UTIs or any upper respiratory infections, you have traveled, any of that could potentially worsen Parkinson's symptoms. I want to emphasize that so much because we have patients coming to the clinic saying, in the last week, I've suddenly progressed. I'm so worried now, things are not going well. And it shouldn't be that way, that Parkinson's itself should cause you to suddenly get worse. So people have fast progression, some people have slow, but it shouldn't be happening in the matter of days and weeks. If that is happening, there is something underlying going on which needs to be addressed. So that is so huge. I've seen that even with my with my own experience with my mom before we were, I got into this in this field, and when we were dealing with it before, and did not realize the importance of that. And I still see patients coming with that. So make sure you realize there is something else going on if you're suddenly falling or suddenly getting worse. We'll talk more about exercise, but that is so much of the key, as you have heard. And we'll talk a little bit more in the other slides coming up. And other thing is maintaining a balanced, healthy diet, which again, we'll talk here in a few minutes, but this is to make sure you're taking good fiber and good source for your body and for your brain. So we'll talk about that, which also impacts your motor symptoms, because if you have not been eating well, or if you have not slept, or if you have not been doing exercise, it hugely impacts those motor symptoms. And every day is not the same, as we know. The thing that's predictable with Parkinson's disease is the unpredictability, and some people have it more than others. So follow your body signal. Today you don't feel quite well, just take a pace yourself, so then take a break. But the next day you are able to do a little bit more, then do it, so that way you're pacing yourself based on what your body is telling you. But regardless, trying to even get in a little bit of activity and rest is very important. And then you feel like over time you are having more freezing or more tremors or something, come talk to your provider. So, there can be dose adjustments made to help you be optimal in how you're feeling. So this is some of the motor symptoms to feel the best. Then we have so much with the non-motor, and I know probably I've not even covered some of it here, which you all are experiencing, but sleep is again a big thing. So I understand that trying to have a routine is so much important, having a structure and a routine, whether it be with the medications or with your sleep. If you take a big nap during the afternoon and then you're not able to sleep much at night, and then it kind of rolls over into the next day, and then you're not being optimal. So trying to have a routine and structure is so important. So it's best to go to bed at the same time, if possible, every night. Try not to have distractions, screens and phones, and try to have a quiet as much as possible, and try to stay in bed. I know it's sometimes hard when you have to get up, use the bathroom multiple times, but try not to get up and watch TV and disrupt your sleep cycle. So try as much as possible to have a routine. If it's okay if you have been active in the daytime and you need to take a nap, but don't take for more than an hour, because it then cuts into your evening time. And I understand that fatigue, again, is a huge non-motor symptom, which a lot of people have, and it is such a multifactorial with the fatigue. It could be part of the disease process. It could be from medications. There are so many variables to the fatigue. It could be that, I've had patients who have had some other underlying problems, like having anemia, severe anemia that has caused fatigue. We think it is the Parkinson's, but it could be some other factor. Or making sure to check your B12 levels and vitamin D, and having your primary care doctor check your labs to make sure you're not anemic or anything causing the fatigue. But if all that is ruled out, and even sleep apnea, that is a huge thing, again, impacting both sleep and fatigue. So if you have, if you're not sleeping well at night, you're snoring a little bit, it's possible, it's a good idea to get a sleep study done to make sure, that is not causing you to have the sleep and the fatigue problems. But that is a true problem, and I completely understand with the fatigue, but definitely check those things out. And sometimes if you can tolerate caffeine without worsening tremors and things like that, we have found that increasing your caffeine intake or taking some caffeine pills can help a little bit alertness in the daytime as well. Next thing is mood, and mood is, again, so many patients have that with anxiety and depression. It is, how dopamine affects, we talk about the motor symptoms and everything. So there are other neurotransmitters like the serotonin, and if you have low levels of that, that can affect your the mood. So it is very important to talk to your provider. And the cognitive behavior therapy, which is more like training your brain and talking through with your therapist or your counselor to sort out some of this and to help you cope, is huge. So therapy is huge for that. And in addition, adding medications like a SSRI or an SNRI based on what your provider thinks is best is huge, because if your mood is down, again, you're probably wanting to sleep all the time, you're feeling tired all the time, and it could just be that you have underlying not feeling good. So that is huge to make you feel optimal, and be your best to address if you have those mood problems, which are very common. And sometimes it is just being frustrated with the disease process, that you were able to do so many things before, but now you're not able to do what you were able to do a few years ago, so that coping mechanisms are huge to be able to be successful and to carry on and realize that, we can help with this. Orthostasis, this is, again, some people have this with, could be where when you are standing, sitting to standing, you feel kind of lightheaded. And this could be from an orthostasis where your blood pressure is dropping. So that is, we need to make sure, and the levodopa, carbidopa can cause some of that orthostasis too. So making sure to check that is not the case for you by checking your blood pressures and working with your provider, and drinking fluids and making sure you take your time. Nothing about Parkinson's should be a fast thing anyways. We have to take our time. So if it means when you're sitting to standing, you take your time before you take that next step, so that, your body can get adjusted. So that is huge. And when we talk about our, in the next slide, I'll talk more about the fluids, which is so huge and important to stay very well hydrated, because that can also impact how you feel with the lightheadedness and everything. Drooling, again, a big problem for some people. And some of the temporary things, trying to chew gum so that you are forced to swallow instead of having the drooling. But ultimately, if it is too much bothersome and you're always needing to carry a tissue around or something, we'll have to look into things like Botox, botulinum toxin, which can be helpful for that as well. Constipation. So again, this comes back to eating a good fiber diet and fluids, but you may do everything right and you could be on medications, and constipation is a real problem, which impacts also the medicine absorption, because all this is going through your gut. And if you're constipated, it's kind of all just sitting there and you're not getting the best absorption of your medicine. So if people say now suddenly I'm not, I'm having to take more medicine, one of the first things we ask is, when did you have a last bowel movement? Because that impacts on how the medicine absorption is. So trying to stay, and then trying to stay ahead of it. I know some of my patients say, I do fine till I'm actually having a problem, then I take some medication. So instead of that, trying to stay on top of it, by having a high fiber diet and adding any medicine to keep your bowels moving is better than getting to the problem and then trying to fix it sometimes. And bladder problems, again, I know a lot of people struggle with this. And I just want to emphasize there is a lot of importance for the pelvic floor physical therapists. They are able to do wonders. I know medicines people try and sometimes it works, may not work, but in conjunction, doing some physical therapy to help get those muscles stronger would be good. But then for men, also, it's a good idea to get your prostate checked to make sure it's not a prostate problem, which in turn is affecting your bladder with overflow bladder or any other problems like that. And doing a bladder training to kind of even using the bathroom on a scheduled break time, that also helps to train your bladder, which is sometimes helpful. And it's a good idea if it is a persistent problem also to follow up with a specialist, with a urologist, to see if there is anything else ultimately that can be done. Some people end up needing Botox or bladder stimulator if it is a real pervasive problem, which is not helping with medicines or anything else, but definitely try the physical therapy for it. All right. So diet and Parkinson's, I know there is so much emphasis and so many questions people ask. What is the best diet? And there's so many diets out there with ketogenic and low carb or high protein. So there isn't enough studies with evidence to say, with Parkinson's disease, which is best. However, it's been found that a general, they call it like the Mediterranean diet, which is a lot of emphasis on fruits, vegetables, whole grains. And if you do eat fish, that is a great omega-3 for your brain in general. Nuts, olive oil. So this kind of encompasses the Mediterranean diet and kind of limiting the red meat and dairy and processed foods. It just makes you feel overall better if you're not eating a lot of the junk food. Sometimes it is hard because you don't feel good and you just want to grab that cookie or but trying to reach for maybe eat a fruit before you want to eat something which is not healthy. It overall makes you feel better when you're nourishing your body with good food, and this in turn helps how you feel with your symptoms as well. Plus helps with things like your constipation if you're eating fiber-rich foods. So it is huge. The diet makes a big difference. There have been some studies that show that low vitamin D can be also associated with increased risk for symptoms. And a lot of people are deficient in vitamin D in general, so it's a good idea to get that checked. Like I was telling before, even for the fatigue factor, it's a good thing to make sure that you are not having a deficiency with it and taking supplementation if it need be. Calcium in general is good. It's good for the absorption along with the vitamin D, but also as we get older, it is good to have healthy bones in case we do fall or, to avoid fractures, to have that calcium intake as well. And the gut microbiome. So there has been so much research lately realizing that there is a lot of relation between our gut and our brain. And that is so important to have a good, healthy gut so that it in turn affects how your brain is functioning. So there's a big relation between that. So again, we talk about the fibrous rich food, fermented food. So those are great to have a good, healthy bacteria in your body. Probiotics are great in that same, in the same thing that it can help to develop those good bacteria and the gut health. And staying hydrated. Again, I have had lately a couple of patients we have seen who had worsening of their symptoms, and they felt like it was just the Parkinson's getting worse. They ended up getting hospitalized for some other reason and found out that they were severely dehydrated, and they thought they were doing good, but our perspective of good is not what actually we should be drinking. We should all be drinking a lot. but more so when you have this, because it impairs everything. Again, your cognition, if you're having cognitive changes, which we didn't really talk about, but that again, the first thing to make sure is that you're staying well hydrated. It can impact fatigue. And these patients, once they were really staying on top of it, I mean, when we saw them, they were with a walker and really doing bad. And then they are coming in walking as if, they just went back a few years ago just from hydration. So it is so huge to stay well hydrated. 64 ounce, about 6 cups is what is recommended. But if you can do more than that, even more power to you. All righty, let's go here. Exercise, and I know we all have heard about exercise is the one thing that we know for sure can slow the progression. Even with my mom, we have, as long as she could keep going, we kept saying, and even when she was bedridden, we are like, let's move, because exercise is so, so important. So at no matter what stage you are, and I completely understand some of you are able to walk and some of you are using a walker probably or a cane, but that should not limit you from not being able to do some form of activity. And it is important to have both aerobics, so cardio, to help maintain a good heart and healthy. Just to have, you just feel better with the cardio, and strength training, that is to get your muscles strong, making sure you are incorporating that. And this big thing is, again, balance, agility. We tend to lose the to be able to multitask. So it is so important to work on that, so your brain also gets used to being able to do that multifunctional, working on agility and balance. And last but not least is working on your flexibility with yoga, meditation, and the Tai Chi is great for balance. And if you love to dance, that again, it helps you moving. So it does not matter what you do, but it is important that you do something and you incorporate a little bit of each of these areas, to be doing your best. And I know there is risk for falls and things like that for some patients, but if you are not really been exercising, it is great to start with a physical therapist who can guide you. And if you have been exercising, you are able to push yourself to do more, you can still work with a therapist. And if you've never done anything, start with just taking walks. Use a little like a step counter, a pedometer, to slowly increase your steps. Even if you can just do 100 steps, start with that and slowly increase each day, because it is so important to slow the progression. And ultimately, it should not be something that you're forcing yourself to do, because if you force yourself to do, you're not going to follow through with it. So find something that you really enjoy. And a lot of my patients, they do maybe an exercise bike or just working on the steps, or just find something that you love to do and stick with it. Do at least five days a week, if possible. And you don't have to do an extensive stretch for like an hour. Even if you can do 20 minutes to 30 minutes, that is huge. So cannot emphasize the importance of that. We see patients who do not exercise versus those who do. And just it makes a big difference when you just see them. And again, sometimes when you don't have the energy or you feel fatigue, I know these are the things patients tell me, but I just don't feel like it. And that is why we need to work to see even if you can incorporate something and help with your mood and everything so that you feel like wanting to do it. And the other big thing is having a routine, even for exercising. So whenever you feel the best, if that is in the mornings or whenever that may be, try to get that done then. Put that in your routine so that you're not pushing it off to later on in the afternoon, and then you end up not doing it. Because some of my patients say that I really want to, I have the good intention of doing it, but then I think I'll do it later and end up not doing. So very important to do it, and try to do it whenever you feel the best. All right. Speaking of, again, therapies, some of you may have done all of these therapies. Some of you may have only done some, but we give so much importance on our therapists out there. They are huge in impacting and how you feel. And some people say that I've done it, but it's not really helped me. But I would say still go to somebody else, give it a try, don't give up. This therapist can help you based on how you are walking or how much you need the gait training or the balance exercise. They are able to work with you individually and the best devices to use. So some patients say those who are using a walker, it does not help because I'm moving, my body is moving ahead, my feet are not keeping up. So there are so many options out there with the type of devices that can be used, and based on how you function, they can guide you for that. So it's definitely important if you can even get few sessions with a therapist. Occupational therapist, again, people with, if you have tremor, if you have reduced dexterity, trouble with writing, using utensils, computers, keyboards, it will be huge to work with a therapist. I know we didn't talk about dystonia, and some people could have dystonia that can also prevent to be able to use your hands well. So if you don't use it, you're going to lose it, right? So to be able to use it's important to do those hand exercises to be more functional. So work with occupational therapist on that. The occupational therapist can also be part of a home health team. If you have safety issues at home, they can help you with figuring out where you need a grab rail or what accommodations you need to be most functional at home. So if you need home health, that includes the physical therapy, occupational therapy, and speech therapy that can be part of your team. So definitely utilize that. And I know speech is a big problem for a lot of people struggling to speak, swallowing. So speech therapy is huge. Speech therapy can also work with some of the cognitive, trying to help with the speech and processing. Because I know that sometimes you can think about the word you want to say, but it's hard to say what you want to say. So speech therapy is huge with that, and also with helping you if you have a lot of, if you, and we don't want you to aspirate, and so if you have swallowing problems, coughing when you're eating or drinking, so speech therapy is very important. And cognitive therapy. So there are some cognitive therapies out there that can help you with memory. And I know a lot of people do have memory and attention and problem solving as a problem. So that working, just like we work our body, working our brain can be helpful. And I know there is, like my mom has dementia with Parkinson's, and it is hard when you have those extra layer to work with, but as much as possible, if that can help you, it is definitely worth trying. And then other things, therapies that can make you feel good. If you love to do any art or music, anything that you enjoy to participate in, and this could be, as a group session outside of home or anything like that, if it brings you joy, you should do it. So, and therapies are great. This could also be if you go participate in a group therapy where you have other people with Parkinson's, and just to have that exchange of ideas and just to be part of it it's huge. And I just put massage therapy here because some people I know with the rigidity or with the dystonia, you're so stiff and feeling so horrible. Just getting a massage therapy sometimes helps to relieve some of that soreness and stiffness. I know it doesn't take it away permanently, but it'll help at least to relax. So if you can, incorporate that. And I completely understand where you all are. Some people have access to a lot of these things, and some of you are probably a little bit more remote settings. We do have, we are fortunate to be here in the big city with everything accessible, but we do have patients coming 3 and 4 hours away, staying in remote areas where you don't have access to this. But you work with your provider to see if there is a lot of, the physical therapy is hard, but some of the other therapies, if you can do virtually or anything else that, so that you still can get the best care, even no matter where you are. I know it can be harder for some people than others, but don't give up on trying to explore the options. And speaking of therapies, I cannot emphasize about the LSVT big and loud. Some of you, I'm sure, have done this. And this is all about making sure you're making those big movements and speaking loudly. So these therapists are trained for Parkinson's patients. So if you end up doing physical therapy, and if you have access to an LSVT, and this is how you can find them. So that if you go to lsvtglobal.com, you can put in your zip code and see if there are any therapists close to you who are trained in it, because it helps if you can do the LSVT. But again, if you are in a setting you don't have access to that, it is better to go to a regular therapist and they can still help you. But always remember, it's all about the big movement. So you're not having those little steps and freezing and those festination where your feet are not picking up. So everything about this, or speaking softly. So everything about the Parkinson's, when you are having these challenges, about big movements. So that is why that is great. And it is great to explore some of the local Parkinson's organization. And some of you may already be doing this, but for those who are not, it's great to explore local, what you have availability for all of these exercises and therapies. Rock steady boxing, I'm sure many of you do this. Again, it is an awesome program to work on balance, agility, getting all the exercise in. So if you have a rock steady boxing close to you, it is definitely even incorporating this along with your other exercise routine. They also try to work a little bit with the cognitive aspects as well. So it is a great program. And cognitive behavior therapy that I was mentioning about before. So these are psychologists and therapists who can help you if you are having challenging, you're having mood or anything, you need to talk to somebody. I'm going to try to see if this will open up here for me, but this is Psychology Today. If you don't know, it's hard to find psychiatrists in general or psychologists. And so this website here, so if you go to find a therapist, you are able to put your zip code, and I'll just put my zip code here. So just to show you that you can find, open up for me. So based on the type of therapy you need, whether it is a cognitive behavior or any other, if you're going through family problems or anything, it is great. And so based on your zip code, you can put, and then, this is a great, Psychology Today is a great way to find some of these therapists. All right, let me go back here. Palliative care. So palliative care is such a huge, huge resource. And I want to emphasize, this is not a hospice. It is not end stage. This can be initiated at any stage of the disease process. So this is to focus, if you are struggling, and I have some patients, we cannot find any resource where they are, or really struggling, the family is struggling, and we don't know, we always refer to palliative care because they can pull in other resources to help you. So if you can initiate this at any stage of the disease process. So I want to emphasize that, and they can help with providing emotional, pain, spiritual, whatever you need, they can help you with. So definitely tap into that resource. We talked about support groups. Again, this is both for patients having this, plus for family members, local chapters of different organizations. And I have some listed coming up in the next slides. But please avail of that, because this, again, it takes a village. It's hard when you are struggling through this yourself. And I know I couldn't have done with some of the resources that we got, and we were able to, it really does take a village. So tap into those, and you need that support. to know that you're not alone struggling with this. And just the fact that you guys are here today tells me that you do want to try to do the best that you can for yourself and your loved ones. So that is a huge step to be able to even, you are coming to these meetings and trying to find the best things. And some of you are probably using a lot of these resources, which is great as well. And then home health, again, we talked about, the PTOT, speech therapy. So if you are not somebody who can go into some facility, avail of that here so they can come to you. And that includes even like a home health aid if you need help a little bit with like activities of daily living, things like that, they can help you with it as well. And the respite care, it is again for caregivers. And you are struggling and you just need that little time. There are places, depending on where you are, it's like a facility that can take care of your loved one for a short time while you get a break from your caregiving responsibilities. So that is a great resource to have as well. And, towards the end stage, definitely for patients who end up having to need hospices, amazing. Patients who have utilized that, it has helped them, with everything. It's kind of the palliative, but even more like end stage. So you may not be able to do other treatments, but they're able to provide you comfort. And, so it's huge to have that resource as well. All right. So this is some of the information, and there is a helpline that is provided by the Parkinson's Foundation, and that is the number on there. If you have specific questions related to your disease process, they are available to answer, to help you with it. And it's not 24 hours, but they are available during the daytime. So definitely tap into that. And then, of course, our PMD Alliance here, they do such a wonderful job with so many resources. And let me see if I can tap into this as well. And with PMD Alliance too, based on where you are located, you can browse by state, and there are a lot of the local resources that you can find based on where you are located. So that is great. I'm just looking at Hawaii, but whether it's a DBS or a young onset, I know some of you have the young onset, so it is great to have that resource for that as well. And let me go back here. The Davis Finney Foundation, they are also local ambassadors that can help. They also have a young onset area that they can help with, but these are the links if you go into them. And the Parkinson's, of course, everybody knows the Michael J. Fox Foundation. They have a buddy network where they can pair you with somebody with Parkinson's who is willing to share their journey and help you through the process. And they are willing participants so that you can connect with them as a resource. And APDA, the American Parkinson's Disease Association, they have a lot of local chapters. And they have a lot of walks and other exercises and everything that is great as well. And this is a Caregiver Action Network. This is mainly for caregivers to find support to help you cope through some of those challenging situations. And if you don't have any of this where you are, try to look if you have any senior center or a religious or church or any other organization where you can be part of to find that support. And this again about medications, I just wanted to talk real quick. I know there are so many new medications that have come in the last few years, and some of them we have tried for some patients, and the barrier sometimes has been the cost of these newer medications. So this is some of the patient assistance program and links on how you can access and tap some of these resources. Some of our patients are part of this PAN Foundation, and that is not income-based at all. Once you are part of the PAN Foundation, it's a yearly thing that you have to renew, and some of you may have it, but it does help with a lot of the medications to be practically free to very low cost. And there is a Good RX, so definitely try to use that as well. So we want you to be able to get access to the medications. And some of these newer drug companies, they also have their own grants that are available. So don't let the cost be a barrier. If it helps you, work with your provider to see how best their, like our office fights a lot with insurance to try to provide the best medications for the patients if it helps them. So, and I just want to share in the end, this is my mom. This is when she was, this was about 2010. This is when my little one, my oldest, was about 2 years old. And this is very young. She didn't have any Parkinson's. And this is in the middle here, just in October of last year when I went to see, when I saw her, and she was still bedridden, but able to sit in the chair. And this is her now, totally bedridden. But she still keeps fighting. So she's still strong and still keeps fighting. So I just want to encourage you all, don't give up. Always stay ahead of this and don't let Parkinson's take over. And yeah. So I hope this was helpful. And yeah, any questions, anything? I will stop sharing the screen.
Thank you so much, Priya. Yes, we do have a few questions. So going back to when you were talking a bit about the motor symptoms and medications, we did have a question because this is challenging, can impact quality of life quite a bit, and that is managing biphasic dyskinesia. When it's wearing off, where it's coming on, like, is there any tips or tricks that you could offer someone in that situation?
Oh goodness, yes, the biphasic dyskinesias are so hard, and it is definitely the medication management, and that is a hard one. I mean, if it is off symptom dyskinesia as our own, it's definitely a little bit more easier or challenging. So I don't have specific, it is individualized and trying to work with the provider to see how best, and it may be that you may have to take teeny tiny little bit of the carbidopa levodopa versus taking too much. It is a lot of that adjustment. So that is definitely a hard and challenging one.
Yeah, definitely.
And I do a lot of deep brain stimulations as well. And depending on if the person is a candidate for it, which again is a whole candidacy for it, sometimes we are able to find success with that, but everybody is definitely not a candidate for the deep brain stimulator. But dyskinesia, sometimes we are able to, address with that.
And then when you were talking about the nutritional aspects, we had a question about, is it good to take a probiotic with Parkinson's? And if so, are there any specific strains that are more beneficial?
No, I don't think necessarily the studies have shown, as long as you are able to take a probiotic. There are some brands, of course, I'm not going to patronize one brand over the other, but which are more, which are not using too many chemicals, a little bit more organic, which would be better for you in general when you take supplements as such. But yeah, other than that, you can use any probiotic. Sometimes there is a prebiotic added to the probiotic, which works, before and after. So either one of those would be good.
Okay, and then, and kind of in the realm of sort of the, I guess, complementary things that you were discussing, we had a question about acupuncture. Do you recommend that for Parkinson's? And have you seen anyone have any benefit from it for any symptoms specifically?
So it is more anecdotal, I should say. I don't think there are studies done to show, if it helps. But especially for bladder, I can think of a specific patient. Again, this is anecdotal, so I'm not going to say to go for it. But they have had benefit with a urologist actually doing an acupuncture for the bladder problems. So it kind of depends. If it is not going to hurt you in any way, if it helps, it helps. But there are not studies to say that, to back up saying that, yes, it does help. But any of these complementary therapies, if you try and if it helps, And if it's not giving you side effects, some patients do try it.
Sure. And then we had a question around an example of a Parkinson's journal to track on, off issues with medications, constipation. Is there anything that you recommend to your patients?
So generally there is like the motor diary that we, and if you just search for motor diary for Parkinson's, there are a few different types, like the Michael J. Fox Foundation has it, the Parkinson's organization has it. So depending which one you like the best, but that helps you track the timing and the side effects that you're having. And so if you just search for motor diary, that is, and there are a few different types, so you can see which works best for how often you take your medicines and what are the side effects that you're having.
All right, so pain is a problem with Parkinson's, lots of different types of pain. And, there's always potential side effects to taking pain medication. Any like general recommendations for people that they can do to kind of minimize some of the pain that they're experiencing?
Yeah, so pain, I know it is definitely such a big thing. So some people have pain strictly unrelated to Parkinson's, right? It could be arthritis, or it could be other orthopedic problems, if that is, and that also limits how you are functioning with your motor function. But if it is truly related to Parkinson's, I know people used to think back then that, with Parkinson's, you don't have pain, but I know, we have learned over time now, pain could be from rigidity, it could be from the dystonia, all of that can cause the pain. So yes, we don't want to be doing narcotics and any of that, because that can worsen your symptoms. If you are able to, like I said, the massage or moving that, getting the range of motion, actually, it may seem hard initially, but if you keep up and you use it, it can help in the long run with the pain. So depending on if you have dystonia, now I know that can cause a lot of pain. So if you need medications for that, or you need Botox injections for that, that can relieve some of that. So it depends. It is such a big umbrella, but certainly trying some of these alternative therapies, because there's limitations with the medications, we can take. Now, if it is some providers do little muscle relaxer if that can help some of it, but there is truly very limited medicines that you can use. So trying to be active and trying to get some other alternative therapies would be huge.
And just to kind of add to that, because I know you talked a bit about, Tai Chi and yoga, which can help
Yes.
with mindfulness, which can help reduce pain. And then how about like biofeedback? Have you seen?
Yeah, that is great. And again, absolutely. So biofeedback, and again, working with that. And sometimes it's kind of training your brain to not be so focused on the pain. And giving those coping mechanisms it's huge, and it's really helpful and worth trying, whether it be through biofeedback, which can be huge, or if you don't have access to that, even just working with this cognitive behavior therapy to help you train your brain to divert and change the behavioral and therapeutic aspects of it. So, and it's absolutely
awesome. So it's really ultimately utilizing all the different tools in your toolbox that you have. You've got your traditional treatments, you have your complementary treatments, and pairing those together and seeing what works. And for some people, it's kind of a trial and error, would you say?
It is. They say that, again, you just know the one person with Parkinson, because everybody is so different and unique. But I want to say that don't let your symptoms stop you from doing things, because there's only so much with the medications, which are huge, which is important. But we have to make sure that, it's like a big cycle. It's a whole ecosystem of things, right? We want to make sure everything is in place so you can have the best optimal life. You don't want to be worried about, or patients say, oh my gosh, what's going to happen to me in the future? Nobody knows whether you have Parkinson's or not, right? But it is definitely understandable. You're worried about it, but trying to take each day and doing all these things and finding those support groups for yourself and for, the caregivers, it is huge. It makes a difference. I just know that because there are days I have, I'm still struggling with my mom, and some days, we have tearful nights, and but the next day it's like a new day. We have to, that you can only move forward. We cannot go back. So I know my mom is fighting still, so I want to keep fighting for her. So I urge you all to also, don't give up and use those resources so that you can have the best quality. Ultimately, I also want to say, do one thing every day that makes you happy, even if it takes few minutes. Try to find that joy in your life. This is something I learned from a conference through PMD Alliance when I went last year to a conference, and I still believe in that. Whether you have Parkinson's or just anybody, we have to find the joy, in life, even if it's for the few moments, because we have to have that quality in life. So yeah.
For sure. I have one last question because I know we're running out of time, but I think it fits really well into this, and what you're talking about is being proactive and being a self-advocate for yourself and for your loved ones, and the importance of, and you mentioned palliative care, and we had someone ask me about this. She said that she asked her neurologist about palliative care, and the neurologist was horrified, thinking that this person was saying that they were ready to end their life. And I think that people often have a very a misunderstanding or a negative view against palliative care, that it's always end of life, like we're only dealing with the last moments, which it is an aspect of that, but it's really more of a broader approach to quality of life. And I just wondered if you could kind of give us some last thoughts about that.
Oh my goodness. If all else I can leave you with is to definitely incorporate that one resource. If you are struggling and you don't know where to go to, or, at any stage, that is so huge. And right now, we see a lot of our patients utilizing that. And it has been such a big thing for everybody, for the caregivers and for patients. Even if you don't know where to start, that would be the place to start. And you can start at any point and tell your provider, I need a referral to that palliative care because that is going to be important for me. So absolutely. It could be end stage, it could be beginning stage, in between stage, any stage, because they can pull all the resources, especially based on where you're located. And we do that for our patients. We don't have access, and we don't know where to go to. So then we refer to them, and they are able to kind of find ways, to provide that emotional and pain management or whatever support is needed. So absolutely.
Is there somewhere specific that people could go to look for where they could find a palliative program in their area if their physician isn't necessarily offering that resource?
To be honest, I have not specifically researched, but I do know that some of these bigger organizations, like we talked about, that I've provided the link to, if you put your zip code, they provide all the resources, and you can always call, like that, the helpline I told you. They are able to search for you and find out in your area. If you especially live remote and not in a big city, they are able to find it for you. So utilize that to be able to have them search for you to find it.
Awesome. Well, Priya, I want to thank you so very much for your time and your compassionate conversation. Not only do you give a lot of great information, but I can just tell that it means a great deal to you, obviously from a personal perspective, and I think we can all relate to that. And so I just want to thank you for that.
Yes, thank you so much. Thank you so much for having me here. And you all, I truly feel for you all, and you can do this. So take it one day at a time. And thank you so much.
Well, we have a tradition at PMD Alliance as a way to thank our speakers. So I'm going to invite everyone, if you don't already have your video up, please turn it on and give Priya a wave of gratitude. And thank you so much for sharing your expertise today.
Thank you. Thank you, everybody. Be safe, stay active.
Everyone have a great day.
And have a wonderful rest of your day. Thank you.
Bye.